Adrian Cush. I'm an advanced physio working in Queensland, and I've given this presentation a few times now. I gave it to the physiotherapy department at my hospital, and then shortly after, the director of pharmacy had heard about some of the studies that are referenced in this presentation, and he asked me if I could present it to the pharmacy department, and then the occupational therapy department asked me to present in their in-service time slot as well. And essentially what motivated me to do this talk was, as a physiotherapist, like, we see patients who present with some vague symptoms, myalgias and headaches and strange clusters of symptoms. And when you're trying to diagnose them, it's really tricky. And quite often these are the kind of patients who require a lot of multidisciplinary treatment. And at the end of that treatment, they're often no better. And it's very frustrating for them, but it also as the clinicians, you're trying your best to put energy and effort in to help them, and it's just not effective. And it wasn't really until I'd realized what was happening with people getting infected with COVID and the long COVID symptoms that you could sort of see, oh, hold on a second, well, maybe some of these patients that we were seeing in the past, maybe they had a pathogen that actually created their symptoms in the first place. So I'll just talk about a few different studies which have only come out relatively recently, which sort of show how pathogens, viruses or bacteria or fungi can actually create these long-term symptoms. The most compelling study that's come out recently was this one by Jornovic et al. In January 2022. So this was a paper published in Science. It was a huge paper. It had over 10 million young adults were involved in this study. So basically, the study looked at whether or not Epstein-Barr virus was associated with the development of multiple sclerosis, because it had been suspected to play a role for decades, but to actually prove causation with a virus and then something that develops decades later is very, very hard science to do. And the team who published this study, they had to look back on very detailed data in the US military TBA data. And what they found was that out of the 10 million, there was 955 people who were diagnosed with MS. And fortunately, with this data, they actually had blood tests that had been taken every 2 years over a 20-year period. So they were able to see if people had been infected with Epstein-Barr virus and then see, did they develop multiple sclerosis? And what they found was that the risk of developing MS increased 32 times after infection with Epstein-Barr virus. So you have a hazard ratio of 32, which is higher than the hazard ratio between smoking causing lung cancer. And so what the authors of that paper were able to confidently say was that Epstein-Barr virus is a trigger for the development of multiple sclerosis. So very, very important study. And it just goes to show how difficult it is to actually prove these things that happen after a pathogen infection. And we've got many other viruses have similar long-term effects. We've got chickenpox and shingles. Chickenpox is the varicella virus, and the first documented case of this was in 1658, and it wasn't until 1954, so 300 years later, that shingles was actually linked to be known as a reactivation of the varicella virus. So for 300 years, you had people, or at least 300 years, you had people with these strange dermatomal patterns of blisters. And the explanation for it was, it would have been all sorts of things, but it took 300 years for it to be, this is actually the reactivation of a virus that you probably caught when you're in childhood. And then you've got other types of viruses that cause other problems like cancer. So that's called an oncogenic virus. And one of the most widely known oncogenic viruses is HPV, so human papillomavirus. And it's a leading cause of cervical cancer in women. And this study looked at vaccination in women with the HPV vaccine. This is another huge study. They've got 1.7 million women looking between, the study went from 2006 to 2017. And what they found was that if you were vaccinated before the age of 17, you had a 90% reduction in cervical cancer incidence. So the HPV doesn't just cause cervical cancer. This is a nasty little virus which can cause vulvar cancer, penile cancer, genital cancer, and oropharyngeal cancer. And even now, in the US, 14,000 men and 3,400 women are diagnosed annually with HPV positive oropharyngeal throat cancer. And then the last pandemic that we had is this Spanish flu, last big pandemic. What they found was that it's linked with Parkinson's disease, causing Parkinson's disease decades later. And the study found that people born during the Spanish flu had 2 to 3 times increased risk of developing Parkinson's disease compared to people who were born before 1888 and born after 1924. And Spanish flu had a similar post-viral illness that was called encephalitis lethargica, also known as the sleeping sickness, which presented with a vague cluster of symptoms: myalgias, headaches, gastrointestinal upset, fatigue. But there's even more viruses are causing all sorts of long-term harms that we hadn't really known about until recently either. Measles being one of them. It was only in 2015 that the paper was published showing that measles can cause what's called immune amnesia. And essentially what immune amnesia is that if you're, some people think that the immune system's like a muscle and that you've got to exercise it and get infected to keep it strong, but it's not like a muscle at all. The immune system is much more like a photo book. And so in that photo book, you've got, pathogens, photos of pathogens that you've either been vaccinated against or been infected with. And yes, your immune system can recognize those pathogens if it's exposed to them, and then it can launch an effective defense against those pathogens. But when you get immune amnesia following measles infection, it's almost like the photo book has had the pages ripped out of the photo book. So it leaves you susceptible to viruses which you previously had a defense against. And of course, there's HIV and causing AIDS. The initial infection for HIV is just a mild influenza type illness. And it's not until 8 to 10 years later that it becomes AIDS. And, AIDS is defined by having a CD4 T cell count below 200, which has been shown to be affected in COVID as well, that you have your CD4 T cell count. And so in Australia, there was a study looking at post-viral syndromes. This study is affectionately known as the Dubbo study. And what they found was that 12% of people with Epstein-Barr virus, Ross River virus, or Q fever still had symptoms at 6 months later. So, it's been established for a number of years now that if you get infected with a pathogen, there's a risk or a chance that you will develop a long-term symptom. And that long-term symptom often it falls under the diagnosis of myalgic encephalitis or chronic fatigue syndrome. But it's not just viruses that can cause this type of presentation. It's bacteria. So in Lyme disease, they present with a similar cluster of symptoms. But what's causing that is the Borrelia burgdorferi bacteria, which lives on the tick. And that creates an excessive immune response, which presents like chronic fatigue syndrome. But also, you've got chemicals that can cause this same type of syndrome. And one of the famous examples of that is Gulf War syndrome. So in the US, 25% of the war veterans who fought in the Gulf War are diagnosed with Gulf War syndrome, and they present with similar cluster of symptoms: fatigue, myalgias, headaches, gastrointestinal upset. And what they think caused that, or the most likely explanation, was that when the US soldiers were in Kuwait and they would come across sarin gas weapons, rather than leave them be and move on, they would intentionally explode those weapons. And what it would do was aerosolize the sarin gas, and it wasn't enough concentration to actually cause immediate harm to those war vets. But having those particles floating in the air was what often would make people present with these symptoms later in life. And then you've got molds that can cause a similar cluster of symptoms. I've got a friend who was living in Sydney paying very expensive rent to live in an apartment, and she was there for 9 months, and the apartment had constant black mold outbreaks. And so unknowingly, she was essentially huffing, mold spores every night, and now she's very disabled from that. Previously she was a high-flying executive working in advertising, and now she's very disabled, cannot work, has ongoing chronic fatigue and myalgias, and it's very sad that a pathogen has created this problem for her. So one way to think about these pathogens is that they're a super antigen. And what that means is it's a class of immunostimulatory molecules produced by bacteria or viruses that result in excessive activation of the immune system. So all of those pathogens I was just talking about before would be considered a super antigen. And so they activate T cells and have a massive cytokine release. They present with those cluster of symptoms. And there's diseases which are known to be associated with superantigen production, such as those ones listed there. So the information I just presented then basically gives you an idea that we know now that viruses and other pathogens create health problems years or decades later. It's not new science a lot of the time, but there are new studies which are proving it in more and more detail. So SARS-CoV-2, it's a bat-borne virus, and bats are a unique viral reservoir. Bats have this exceptional ability to host viruses, but they don't present with clinical disease themselves. And they have hosted some of the nastiest viruses that have ever existed on the planet. They have hosted SARS-1, Ebola, rabies, Hendra virus. And the theory of why bats can host these nasty viruses is it's a defensive mechanism. They evolved with it over millions of years to protect valuable real estate, which being the caves that they lived in. They only have little teeth and little claws, and so if they weren't able to defend that territory very well, then they would need to have some other sort of weapon. So that virus causes SARS, severe acute respiratory syndrome. And the unique thing about what happens in the lungs when you are infected with SARS is that it creates what's known to be a vascular disease affecting the endothelium of the blood vessels, which is that innermost lining. And so it can be thought of as a pulmonary vasculopathy rather than an airway pneumonia. And it most commonly affects the vascular regions of the lungs and less common in the large airways. So a lot of the time people don't really get a productive chest despite their saturations dropping. And one of the findings that you'll see on the CT scans is the ground glass opacities. And those are these hazy areas of increased density. So how does the virus reach the lung? The virus is inhaled, but it doesn't cause the disease on the visible airways of the CT scan. So the airways, the areas of lung damaged are the least accessible airways. So the bottom, the back, and the sides of the lungs. And the medical imaging characteristics are vascular. You get the dilated blood vessels, you get the clotting and vascular congestion, you get the microvascular disease, perfusion defects, pulmonary hemorrhage, signs of pulmonary infarction. So how they think that the virus actually enters your lungs, or if it's not being breathed directly into your airways, is that your upper respiratory tract is the first site of infection, so your nasal membrane. And the ACE2 receptor, which is the receptor that the virus binds to, is expressed 200 times to 700 times more intensely in the nose than in the airways. Once you're infected in the nose, the virus starts replicating, and it starts replicating in your mouth. And your mouth becomes like a viral factory. And with the levels of saliva reaching up to 100 million virions per mil. And there's actually a link between the high viral load, so the concentration, and the disease severity. And a high viral load in the saliva is a stronger predictor of death than the patient age. And that was independent of the nasopharyngeal load. And interestingly, what they found was that gum disease was linked to a poor outcome in COVID-19 with an odds ratio for death of 8.81. So if you have poor oral health, or you have gum disease, you're more than 8 times more likely to die or from a COVID infection. So how does that happen? Well, the virus essentially passes from the saliva across the gums into the blood. Now, the virus passes down the blood, blood vessels of the neck and chest to the heart, and the virus is pumped from the heart into the pulmonary arteries, and the virus is delivered to the small vessels of the lung peripheries. Viral binding with the endothelial ACE2 receptor increases angiotensin 2. Raised angiotensin 2 leads to vasoconstriction, immunothrombosis, and vascular congestion. And then the vascular congestion leads to abnormally dilated blood vessels and causing that ground glass opacification. And the bases and the edges of the lungs are dominantly affected. So if it affects the endothelium, it's worth talking about what exactly is the endothelium. The endothelium is a huge part of our bodies. It weighs approximately 1 kilogram if you were to remove all of the innermost lining of all your blood vessels, but it takes up a huge surface area. It's 4,000 to 7,000 square meters of surface area. So its role is that it lines the blood vessels and regulates exchange between the bloodstream and the surrounding tissue. And it plays a role in vascular permeability, coagulation and anticoagulation cascades, regulation of vascular tone, the immune response, and formation of blood vessels via vasculogenesis and angiogenesis. So if you're getting your endothelium inflamed and creating endotheliitis, you're going to have significant health problems. So one way to think about this is that if your body is a city, then COVID is a disease that attacks all the concrete and asphalt in that city. And so anywhere that has any organ that has an ACE2 receptor, the virus can get into and create harm in that organ. And that's why people are presenting with so many strange symptoms. There's more than 200 symptoms now across multiple organs that have been reported with long COVID. So this was a study that was published in January this year by Hannah Davis and Eric Topol. And what they found was that, this paper was probably the most comprehensive summary of long COVID to date. It synthesized a lot of the studies that had been done and presented it in a really easy to read and easy to understand way to view it. So with long COVID, what's the rates of long COVID? It's at least 10% of infections are causing long COVID. That means 65 million estimated globally when this paper was published in January, which was going to be an underestimation, and cases are obviously increasing daily. So 10 to 30% of non-hospitalized cases will get long COVID, 50 to 70% of hospitalized cases, and 10 to 12% of vaccinated cases. So you've got about, best case scenario, if you're vaccinated, you've got a 10% risk of developing long COVID. So what are the most common symptoms? Fatigue is the most common, 58% of long COVID symptoms. Then you've got headache, attention disorder, anosmia, breathing difficulties, dyspnea, chest pain, hearing loss, sleep disorders, hair loss, some pretty nasty and disabling symptoms. Long COVID is the highest percentage of long COVID cases are in females between 36 and 50, mostly in non-hospitalized patients who have got mild acute illness, which is mostly everybody. And there's currently no validated effective treatments. So this study hypothesized the different mechanisms for how you develop long COVID. So you get immune dysregulation, and what they found was that there's reactivation of viruses, specifically Epstein-Barr virus, that one I was talking about before, that causes multiple sclerosis, and human herpes virus 6 as well. You get persistence in the gut as a cause of long COVID. You get an autoimmune response, you get blood clotting, and you get dysfunctional neurological signaling in the brain stem or the vagus nerve. So the harm to the immune system is now very well established. Many papers have demonstrated significant harm to the immune system. There's exhausted T cells, there's reduced CD4 and CD8 effector memory cells. The CD4 cells were the ones that when the count is below 200, and if you've got HIV positive, then you get diagnosed with AIDS. It's got a lack of naive T and B cells, low cortisol, cytotoxic T cells, viral persistence in the reproductive system, cardiovascular system, brain, muscles, eyes, lymph nodes, lung tissue, and of course, reactivated Epstein-Barr virus and human herpes virus 6, and that's associated with fatigue and neurocognitive dysfunction. Now, this was some data that came out from the Multiple Sclerosis Society of Australia. I actually haven't seen the specific data, but this was a media release that came out in February. And what they said was that multiple sclerosis cases are rising and accelerating in Australia. And if we know that, COVID is causing reactivation of Epstein-Barr virus, and we know that Epstein-Barr virus is a trigger for multiple sclerosis, well, I'd be very surprised if COVID is not directly, causing the increased rates of multiple sclerosis. And then we've got, other organs. You've got the vascular issues and the cardiac damage. We've got increased risk of DVTs and pulmonary emboli and bleeding events. We've got harm in the heart, specifically what's happening in a lot of in some hearts is some asymptomatic cardiac fibrosis. And basically your heart has those ACE2 receptors. So if the virus has made its way to your heart, then you're getting replication of the virus within your heart, and then you're getting fibrosis within the cardiomyocytes, so the heart muscle cells of the heart. And that is what is causing this, these increased rates of arrhythmias and increased rates of cardiac events. And so if you have the perception that there's been more heart attacks lately, well, that would be correct, because the data from the CDC showed that, from January 2018 to February 2020, in males aged 25 to 54, the number of heart attacks or heart attack deaths and respiratory deaths per month was 7,000 deaths per month. And then from February 2020 to July 2022, that went up to 9,800. So you've got about a 30 to 40% increase in the number of cardiac and respiratory deaths since the pandemic started. So it didn't start when the vaccines were rolled out. It started when the pandemic started. We also get neurological and cognitive symptoms too. You get sensory motor, memory loss, cognitive impairment, paresthesia, dizziness, sensitivity to light and noise, loss of smell or taste, autonomic dysfunction. You get audiovestibular problems, tinnitus, hearing loss, and vertigo. All of these significant symptoms, they're often dismissed as brain fog, but it's not brain fog, it's brain damage. These people's brains are being harmed by this infection, which is very serious and very disabling. And unfortunately, the data is showing that each infection is actually causing more harm to you. So this was a paper that came out, published in Nature in November last year by Ali, and this was using that US DVA data. And so they've got huge numbers in this study. They've got 5 million people in this study were included in the group with 0 infections. And then there was 234,000 in 1 infection, 28,000 with 2 infections, and then 1,000 with 3 infections. And what they found was that for all of these conditions on the side, each infection was worse. So just to orientate you to this, this image, this is basically a hazard ratio table, and 1, then there's no increased risk of developing that symptom or that problem after the infection. But so, for example, for hospitalization, if you had 1 infection, which is the green, that your hazard ratio of being hospitalized after 1 infection was about, say, 1.2, 1.2 times more likely. But if you had 2 infections, that jumps up to about a 4 or 5. And then if you had 3 infections, that goes up to about an 8 or a 9. So each of those hazard ratios is getting worse after each infection. And so you can see it's worse for hospitalizations by the 3rd infection, worse for all of these things: cardiovascular problems, diabetes, fatigue, gastrointestinal upset, your kidney problems, musculoskeletal, neurological, and pulmonary problems. So each infection is causing more harm than the last. And these are some images from that Davis study. So it causes problems in the heart, the lungs, the immune system, the pancreas, the gastrointestinal tract, neurological system, the kidneys, the spleen, the liver, the blood vessels, and the reproductive system. It's causing significant harm to multiple areas of the body. And because I'm a physio, I included some slides that are relevant to physiotherapy. What injury did these 4 wallabies have in 2022? If anyone knows their rugby, then they would know that they all ruptured their Achilles tendon in 2022. And in rugby union, an Achilles tendon rupture is actually a very rare injury. And to have 4 wallabies in the 1 year rupture their Achilles is just that is unheard of. And it just happened to be the same year that Australia let COVID rip. So would these players have been infected with COVID? Probably. Did COVID cause these Achilles ruptures? We can't say definitively, but if we think about if COVID is a vascular disease, it affects the innermost lining of these blood vessels. Tendons need a healthy blood supply to remain, to retain their elasticity. And if you impede that in any way, the tendon health is going to be affected, and then it is likely that it is more likely that you're going to have an increased rate of Achilles ruptures. So that was my anecdotal observation of Achilles tendon ruptures, but luckily there was a study to back up that anecdote. And this was done by Bayat al, and it only just came out in 2023. And this was looking at the number of Achilles ruptures in the NFL. And so what you can see is the number of Achilles ruptures over those years, sat around, the 6 to 8 to 10 to 15. And so you can see over time, the Achilles rate ruptures were going up, and players have been getting older. So you can explain that via that way. But in 2021, 2022, that is a significant increase of the number of Achilles ruptures. And this is, the peri-pandemic COVID era is how the authors of that study referred to this as. So it's happening in the NFL. There's an increased rate of Achilles ruptures. And this is from that same study. And what they looked at in this study was the number of Achilles ruptures and repairs that had happened within a number of counties within specific states of the US. So in these counties, in 2017, 288 ruptures. In 2018, 261. In 2019, 291 ruptures. So basically you had about, say, 280 was the average number of Achilles ruptures that you had in those years. Fast forward to 2021, and there was 395 ruptures. So again, you're getting an increase of around 30%, 30 to 40% increase of number of Achilles ruptures. So where are we now in Australia? We've got more than 1,000 Omicron subvariants. They just keep mutating. The variant that caused most of the harm for the first few months of this year was the XBB 1.5. And even that is on the decline now in Australia compared to some of these other variants. And this image here, this shows where the different variants sit in terms of the ACE2 binding ability is on the x-axis, and then the ability to escape immunity is on the y-axis. So basically, anything over in this corner is going to be a nasty variant, and that XBB variant was, it had a superior ability to bind to ACE2, and it also had the ability to escape prior immunity, whether by a vaccine or previous infection. But this is being replaced by XBB 1.9 and 1.16, and it's XBB 2.3 is causing havoc now overseas. So where are we now in Australia? We've got PCR testing sites shut down. We have rats that have got sensitivity reduced against new variants. We've got reduced vaccine booster uptake, and we've got mask mandates removed in hospitals. The number of people vaccinated in Queensland, we had 86.8 had one vaccine, 84 had 2 vaccines, 65 had 3, and 47 had 4 vaccines. So I don't know what the data is for showing the 5th vaccine, but you can guarantee it would be lower than that. And the other thing about the number of cases, if you're making your decisions on your COVID risk based on the number of cases in the community or the number of cases that are reported, initially back in January 2022, that would have been a logical and sensible thing to do, because the number of cases, which is the blue line, was reflecting what was happening in the community with the number of hospitalizations. And you can see it followed it almost perfectly in those first few months of 2022. But then as time went on, the number of cases being reported was dropping lower, but the number of hospitalizations was still high. So you can see there's quite a large discrepancy. And then you fast forward to the start of this year, and you can see the number of cases clearly doesn't reflect the number of hospitalizations. So the number of reported cases does not reflect the prevalence of the virus in the community. And another way to think about how protected your community is how recently they've been vaccinated. And we know that vaccines wane, at the 4-month mark. So in Australia, if you consider somebody to be fully vaccinated, if they've been vaccinated within the last 120 days, well, only 2.9% of Australians had been vaccinated within 120 days back in January this year. And in January, we had some terrible numbers. The first few weeks of this year, we had some ridiculously high numbers of deaths. And on January 13th, we were actually the worst in the world for the number of cases. And unfortunately, that trend continued. We've been the worst in the world from February to February. You can see the difference between Australia and the United States and the United Kingdom. And then, so that's what it was from February to February. And this is from today. So from May until May this year, this is where we are compared to the United States and the United Kingdom. So this is the cumulative deaths per capita per million people in the last 12 months. So not a lot of Australians actually realise how many deaths we've actually been having in Australia, because there's been just a media blackout, and it's not covering it in the same extent that it was in 2020 and 2021. But it's not just the official number of deaths that's happening. That's a problem in Australia. We've got excess deaths. So we know that COVID causes ischemic heart disease, increased rates of heart problems. We know that COVID causes increased rates of diabetes. And we know that COVID causes cerebrovascular disease. And so for each of those conditions, which are some of the biggest leading killers in Australia, we had 17% excess deaths, from January to August 2022 for ischemic heart disease, 14% extra diabetes deaths, 14% extra cerebrovascular disease deaths. So how did we get here? We had some of the worst media messaging in this country. This newspaper clipping here on the right from the Courier Mail, I remember reading this back in November 2022 November 2021, and just being absolutely shocked by the title. To be calling Omicron a friendly mutant, Christmas hope, milder Omicron variant may replace deadly Delta. I think this just really just showed how much they were trying to just push a message that this virus was not going to be a problem. It was going to be safe. And so there's just been constant minimizing from a small number of infectious disease experts who get called upon to just basically provide information or quotes for newspapers that have been proven to be false later down the track. We've got Catherine Bennett talking about good reasons to believe COVID cases may not skyrocket as New South Wales opens up, which they did. We've got Nick Coatsworth talking about Omicron clearly not more dangerous than the flu. We've got Peter Collignon talking about Omicron outbreak could be over in just 2 weeks. That was in January 2022. We're talking about in August 2022, talking about the war against the virus is nearly over and how cases are going to drop even more. Just stuff that was proven later to just be nonsense. It wasn't true at all. In the UK, they're talking about front page of the Daily Mail talking about let's not return to face mask madness. Catherine Bennett being quoted that cruises are safe, even though we don't have amnesia. We remember that cruises were very, very dangerous places to be because you're cramped on there, breathing each other's air. There's just so many examples of information that was presented in the media which later turned out to be false and misleading. And it wasn't. There's never a correction or an admission of error by these guys. Nick Coatsworth talking about the year that the pandemic ends, talking about that the virus wasn't airborne. Flu is more dangerous. That was in February 17th, 2022.
But clearly that is nonsense, because the number of COVID deaths in 2022 was 14,000. We compare that to the average number of influenza deaths over all those years, and you can't even compare the two. Like, it's ridiculous. So, who's benefiting from having these people, minimize the threat of the virus? Well, probably the same people who have been funding, the climate change misinformation for decades. If we look at what big oil's big profits were in 2020, they all plummeted because nobody was traveling and using petrol and fuel to fly planes. They weren't traveling to work. So people weren't consuming fossil fuels at the same rate. And so there's been a big push from the fossil fuel interests to try to get people back to normal and back to consuming fossil fuels once again. And I mean, the reality is that SARS-CoV-2 is a BSL-3 pathogen. If you're at a university and you wanted to conduct research on SARS-CoV-2, you're going to have to wear this level of PPE. But you could go to any primary school or high school in Australia now, walk around unmasked, go into each of the classrooms, and probably you're going to leave with COVID. That's how prevalent it is in all the schools at the moment. And so what are they saying now? They're trying to talk about it as if it's a rich hybrid immunity. And it's just another way to minimize the threat of the virus. And, if we think that the politicians are going to, make the decision that's going to be in the best for the best outcome for us, it's just not going to happen, because it's such a low priority for politicians at the moment. This was the Pew Research Center conducted a poll in January 2023. And they looked at, what is the priority amongst Americans? Strengthening the economy, number one; reducing healthcare costs, number two, which was related to COVID anyway. But dealing with the coronavirus outbreak was the lowest ranked priority in Americans. And, it would obviously be very similar in Australia as well. And so if it's not a priority for the people, then you can't expect the politicians to actually bring about the change and get things back under control. So looking at how some of these other countries are going, who are 2 years ahead of us in Australia on with their COVID experience, COVID journey, is that it's terrible. The UK, they've got the number of reinfections is on the rise. There's staff shortages force UK doctors to pick which cancer patients to treat promptly. The number of people aged 16 to 64 in the UK not seeking employment due to long-term sickness went from 2.13 million to 2.55 million. The Chancellor Jeremy Hunt is begging people who have retired early or have been off sick to return to work. Killing children. Back in January, there was 35 children who died, and the number I saw recently in another paper was about 50. The temporary morgues are being opened across the UK to deal with surges in deaths. That was January 2023. How's the USA going? They've got increased distribution of fungal infections. They've got the predicted labour force is about 3.5 million less than it should have been from 2020 to 2022 and 2023. That article I showed just before about the strep A deaths. We're having the same problem here in Australia as well. It's terrible. We had a communique from Queensland Health that went out within Queensland saying that to be on the lookout for the spike in the number of strep A sepsis cases, and what to look out for if a child presents with, or an adult presents with sepsis. And it creates horrible harm. These strep A is a bacteria which is very common, and normally your immune system has it under control. We probably have it on our nose and around our mouth right now, but if your immune system is functioning and not weakened, it can handle it. But if you have a virus which we know causes immune dysregulation, then statistically you're going to have more rates of these opportunistic infections of previously relatively harmless bacteria. Yeah, it's just very, 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 very sad to see, because it's causing terrible harm to a lot of children.
And also, as our humans, our life expectancy is decreasing. This is only after 3 years of the pandemic. What's it going to look like in another 3 years, another 10 years? Of having a virus which we know persists, we know causes long-term harms. It's scary to think about. So, we're in a bad place at the moment, but it's not hopeless. What lessons can we learn from history? So I don't know if anyone is familiar with John Snow and his role in the cholera epidemic, but John Snow he's regarded as the father of epidemiology, and he played a pivotal role in using his epidemiological skills to help solve the 1854 cholera epidemic in London. And basically what he did was he looked at a map of London, and he was able to identify that there were certain clusters of cases of cholera within London. And he just used his logical brain to think, well, what's unique about that area? Why would there be clusters there? And what he thought was happening was that the sewage was actually polluting the drinking water. And so he went and famously turned off the Broad Street pump to confirm his suspicions, which, surprise, surprise, actually stopped that cholera outbreak within that region. And what he realized, and what the people of London realized at the time, was that if you that clean water is actually very, very important to the people. You need to drink clean water if you want to prevent waterborne disease. It's very obvious. And so this was the start of the clean water revolution, and there was resistance from the status quo. John Snow went to the people in power at the time and was saying, we need to redo the sewage system. This is clearly going to cause harm, and people are going to just keep getting infected with cholera if there's sewage mixing with the drinking water. And then there was pushback, but eventually the right thing happened in the end, and the London sewage system was upgraded, and that was finally completed in 1870, and it's regarded now as one of the great engineering feats of the 19th century. So, just like how there was a clean water revolution, we need a clean air revolution. I'm sure we all look at that glass of dirty water and you think, no way. There's no way you would drink that. That's disgusting. But it's the same with our air. Unless you've been told that the air you breathe is important to your health, to prevent the spread of respiratory viruses, then it doesn't really even enter your mind about how important air is. And so to have a clean air revolution, we have all the technology available now to do it. It just takes a bit of will. One of the best ways to measure whether or not the air around you is safe to breathe is a CO2 monitor. And a CO2 monitor is a way to measure how much carbon dioxide is in the air. So basically, if you've got people crammed in a room and they're exhaling carbon dioxide, the carbon dioxide level will rise up. And if one of those people has a respiratory virus and they're aerosolizing that virus into the air, well, if that air is, if that CO2 level is rising, you're breathing in their expired air, then, it's more likely that you're going to get infected with that disease. And, one way to think about it is that, if the CO2 level of outdoor air is about 420, or it's going up, unfortunately. In a room with a few people, if that CO2 gets up to 4,000, gets up to 2,000, then the percentage of rebreathed air is about 4.2%. So 4.2% of the air that you're breathing in has been in someone else's lungs first. And if you get up to 4,000, you're getting up to 9% of the air has been in someone else's lungs first. And so this was a CO2 monitor reading from one of my friends who gave it to his son who went on a year 6 camp. And this is so anything green is, it's below 1,000, and that's deemed to be a safe level of CO2 in the air. And so the son, when he was on the bus out to camp, it got up to 4,000. So, that 4,000 level, that's about, 9% of the air that you're breathing in has been in someone else's lungs first. And they come back to the camp, breathing safe air, goes into the cabin at nighttime, and the cabin with, a few boys in there gets up to nearly 2,000. And the son realized that,
after the first night. And so the second night he opened the windows in the cabin, and so it was down more along that 1,000, and the third night down along that 1,000 level again. But then on that bus trip back home, it was a rainy day, and so if you've ever been on a rainy bus, you can visualize it where there's the windows are all foggy, and people, the kids are all riding on the windows. The CO2 level for that time was nearly 10,000 for the children in the bus breathing in respiratory. Back on this previous slide, anything above 2,500, it creates major cognitive dysfunction. So if you're at 10,000, you as a severely higher level of CO2. And other countries have realized this. France has brought in legislation to regulate the level of CO2 level within daycare and schools. It's a very, very important part of monitoring or part of the clean air revolution. But also masks. Masks are another important way. People 100 years ago didn't have access to prevent the spread of respiratory viruses. What this study here shows that basically, if the source was infected and they were wearing nothing, so in a maskless society, if someone's infected, you've got about 15 minutes you could expect to be in a room with someone before you could, likely get infected. If the person who's infected is wearing nothing and you're wearing a fit-tested, if the person is wearing a fit-tested N95 and you're wearing a fit-tested N95, you get about 25 hours of protection. So you can use this image to see where non-fit tested N95s fit in, and typical surgical mask and typical cloth mask. But you can see there's a hierarchy of protection that you get from each different type of mask. So essentially, a mask is not a mask. There is masks that are really effective, and there are masks that are ineffective. And so you want to be making sure that you're wearing the best mask possible. And so N95s, the polymers that make up the fibers of the N95, they've been electrostatically charged to attract the airborne particles that are floating in the air. So they're magical. They didn't exist 100 years ago during the Spanish flu, and so we've got them now, and we should really be using them. Another aspect of the clean air revolution is far UV light, and basically this is a technology that's used to kill microbes that live in the air. At this certain number on the electromagnetic spectrum, you can expect to have 99% of virus killed within 16 minutes. And so the Washington DC Ronald Reagan National Airport has this in place. Solution, and they're all achievable. They all exist now. Most of them are low cost, including just opening a window and just being mindful of being outdoors when you can. So to deal with this pandemic, we needed many strategies to protect us. And initially in Australia, we did have a lot of these strategies. The Swiss cheese idea, and unfortunately, what we've currently got now is basically just vaccines. All those other protections of physical distancing, masks, hand hygiene, avoiding touching your face, limiting your time, fit testing, ventilation, government messaging and financial support, quarantine and isolation. They're all gone, and now we just have vaccines. And the crazy thing is that this, for hundreds of years, Florence Nightingale in talking about ventilation and warming, she even wrote it in caps lock because she understood how important it was, to keep the air he breathes as pure as the external air without chilling him. And the billionaires know about this. Recently at at the Davos World Economic Forum meeting, they had HEPA filters in the buildings. If you can see these two gentlemen for their meeting, they're wearing snow jackets. This is in Switzerland in February, and these guys have clearly got outdoor air coming in, or else they wouldn't be wearing these jackets indoors. And the billionaires, they used PCR testing, and it was linked with your with a wrist bracelet. And so if your PCR was positive, well, they would disable your wrist bracelet, and then you weren't able to, and using that UV light. So it's a lot of information to have been presented with, and I've just got some my take-home messages from this talk is that SARS-CoV-2 is a bat virus. Humans are not bats. We shouldn't be trying to get infected to get through this. Bats have had their immune systems evolve over millions of years to deal with this, and our immune systems are totally different. A mild COVID infection can lead to serious long-term illness. The symptoms you feel in the acute phase are caused by your immune system's reaction to the virus. It's not the virus itself that you feel that gives you the fevers and the night sweats and the fatigue and those initial symptoms that you get. That's your immune system's reaction to the virus. Each reinfection increases your risk of harm. Protection from vaccines and previous infection wanes over time. And look, you don't want to be the last person to realize that repeatedly catching COVID isn't harmless. This will not end well if you keep getting infected with COVID. And, some take-home messages from Dr. David Berger. He's one of the most influential people on Twitter and in the information ecosystem for COVID in Australia and globally. And his rules are simple. Number one, do not get infected. Number two, do not get infected. Number three, if lower viral load as possible while as vaccinated as possible. And so, yeah, if you'd like any more information on where to get reliable information from, well, I think Twitter has been the most reliable source throughout the pandemic, because you can actually follow experts in their field. And four of the most trustworthy experts throughout this whole pandemic have been Professor Raina McIntyre, the head of the Kirby Institute, Professor Brendan Crabb, head of the Burnett Institute, Dr. David Berger, and Dr. Monique Ryan, the MP who's also a neurologist. They've been constantly putting out useful, helpful information to people that's been proven to be right in the long run, very importantly. So, yeah, thank you for taking the time to listen to this presentation today, and hopefully you're able to maintain your health and protect yourself from COVID as best that you can. Take care.